got with us today the talented Dr. Asha, who has secured a wonderful rank in NEET SS 2022. Her rank is 6th rank. Many congratulations on this, Dr. Asha.
Thank you so much, ma'am. Thank you so much.
Dr. Asha, tell me about yourself first, then we'll discuss about the exam and your strategies for the exam.
Yes,
so let's hear it from Dr. Asha.
Ma'am, I have done my MS from TNMC NAR Hospital, Mumbai. I have done my bond from KEM Hospital, Mumbai. And after that, I have, after 6 months of completing bond, then I had started preparing for NEET SS.
This was which year, doctor?
Ma'am, 2020, when actually I had prepared for oncology. At that time, when I started looking for the material, not much of things were available for gynae oncology. Nothing was available, So it was very difficult. There was no guidance. Somehow I picked up the big books and I tried to prepare oncology. But 1 month when the notification had come in 2020, they had clubbed the exam. So that is why my rank was 500 and something. So yeah, but after seeing the paper, I realized that I can do it. I just need to prepare. Once I, prepare that other subject also, then I can do this. This can be done. It's not key, it cannot be done. So after that, I started preparing again. And still you were not into the picture. You came a little late into the picture. But I was so thankful that I came to know about you after that 2020 exam, when in April you had started your course and I had joined it. So, and I'm really very thankful that I paid attention to it and I joined Reproneet because I needed to, cover the content, and I needed all the guidance that you had given, your all course, your videos, your notes, everything is, it helped me to, cover all the content. I had not read in my PG period at all because there was no time, as I was in a BMC hospital and I was the only JR1. I was the only JR in first year, second year, third year in MS. And you must
have been very difficult.
It was very hectic, ma'am. It was.
I have done residency from Mumbai only, a municipal
hospital. So you must be having a pretty good idea.
And imagining to be the only resident in such a busy hospital, you cleared the exam with all of that work. You did that work for 3 years. That's commendable in the first place,
Yes, ma'am, because people used to call me
getting through with that Herculean task.
Thank you so much, ma'am. People used to call me one-man army because I did not quit.
So
and yeah, so during that period, I did not have time. And during PL also, I just somehow managed to pass the exam. But I passed it with good marks. I got 67.8%. So that was fine. But after that, I 67% in my PG period.
Exit exam.
Yes, ma'am.
Yes, that's wonderful. You, in your UG times, you were a gold medalist in pediatrics, and then 2 months of preparation, you've got 68% in exit exam. So you are definitely a talented student, Dr. Asha.
I am a hardworking and diligent student, ma'am. I am not intelligent, but I am definitely
That
diligent.
is very humble of you. You studied for 2 months and then you got such a good score. You've got, anyways. So we know that you're talented. You're hardworking also. What else does one need to clear an exam? So let's hear it about your journey further. So April you joined and then you started preparing with Reproneet.
Yes, ma'am.
So what happened in the 2021 exam?
So the exam got postponed and we got more time. And for infertility part, I was totally dependent on your videos. I used to see them. I used to, so I had made this schedule. The day you had taught one video, so, I have to in the morning, in the evening or the other day, you used to upload the video. So that was, I had to do that. And I was very consistent in that the next day I have to make notes. I have to, listen your video again and again. And I have to complete that topic on the next day. So that was the schedule I was following after watching your videos. And I had never thought, कि reproductive medicine मुझे इतना अच्छा लगेगा. But after, listening to you, after every class, and I was like, yeah, I love her. The way you teach is so good. I was like, yeah, Repro was a big task for me. But you had made it so good. I was so I was not worried about reproductive medicine when I was giving the NEET SS exam, because it was covered so well. And so the exam was fine. I had prepared, but the mistake which I did in 2020, I got All India rank of 64. So the mistake which I did was I invested everything in the AIMS exam. So INISSET was in December. So I prepared according to that. So I was hopeful for the exam. At that time, I was not knowing the criteria is different. The interview is different. You crack the first exam,
You
the
might
MCQ
practice
exam.
them,
Yeah, but for selection they take people who have 2 or 3 years of oncology experience. So I
yes.
did not pay attention to that. So that was my biggest mistake, because NEET SS was only 3 weeks after the INISS. So
Okay,
though
so
I
you
was
didn't have
selected
to.
there, but I could not get through the interview, and I had very much less time for NEET SS. So I was not confident in my preparation at that time, because I was thinking that I have invested my time in oncology, and OBS, reproductive medicine, gynec was there, which I had to revise, but I had no time. So that was a mistake which I did. I still think that last time my preparation was good. The exam was very good. The exam was of standard,
Yes.
standard exam it was. Good questions were there. And everything, whenever I was attempting an MCQ of that JAN exam, you were coming in my mind, because I used to listen to your videos again and again. I used to clear those concepts. So everything was like, हाँ, ये तो मैम ने बताया है. Okay, okay, ये तो मैम ने बताया है. चलो, चलो. So it was like that. And I was so hopeful for that exam. But the mistake which I did was I was not, mentally prepared. I was cursing myself that people have read so much. I was comparing myself with others. Okay, others have read this much. I have not read this much. So I will not get, others will get. So that is a, mistake which you are not supposed to do, which I tried not to do at this time. Throughout the preparation, it is stressful, especially if it is your second or third attempt, because doubts start coming whenever I in this preparation, whenever I was studying some topic. So I had already read that topic. So whenever I used to start that topic, the doubt that used to come into my mind was कि ये तुमने ऑलरेडी पढ़ा है, तो पहले भी सिलेक्शन नहीं हुआ, तो इस बार कैसे होगा.
This time you
तो
were very doubtful of yourself.
यस मैम, ऑल दोज थिंग्स. तो इस वजह से ऐसा रहता है, तो इस वजह से वी नीड टू हैव दैट माइंडसेट. सो दैट वाज द थिंग व्हिच आई चेंज्ड इन दिस एग्जाम. आई केप्ट माई सेल्फ हैप्पी, आई केप्ट माई सेल्फ मोटिवेटेड, and the one thing I kept myself telling, see, I have traveled a journey from 500 to 64. Okay,
That
and
was
I haven't come this far just to come this far. So this
yes.
was the thing which I used to tell every day to myself, and I used to prepare. And then as I have already told you, I had made contact with Dr. Swati, and we had discussed, and
Study together.
we decided to prepare together, because she had also got a good rank last year. So we were there. So we started studying together, and that was a really good point. I really, when we were studying together, so it was a positive point, because the notes was yours. Our focus was to complete your notes 3 or 4 times. We had started with that. Our priority with that, we had started with that mindset. We are starting, so we have to complete your notes 3 or 4 times. That was the thing. Still,
Wonderful.
first time when we were trying to cover the subject, so it took around 1.5 months to cover the entire subject of
That is very
gynae,
quick. That is very quick.
reproductive
It took me
medicine,
2 years.
and oncology, everything. So we did that. And again, we were like, okay, we'll prepare, and then we'll see if we are studying together, and if both are getting benefited, if it is, mutually good for both, then we will continue. And we had continued this, studying together till the last day of exam.
Wonderful.
On the last day
So
also,
studying with someone helps.
yeah, definitely. And I was, because of the personal nature of Dr. Swati, she is a perfect combination of beauty, brain, and she is so joyous. So half of my tension was, it was, diluted, because I was continuously with someone. She used to motivate me. I used to motivate
It
her.
is so good that
So
both of you found each other through reference.
yes, ma'am. During this period, so it was very good, and it was very nice. And till the last day of exam, We had, we tried to cover the important things, whichever you had told. For example, on the last day also, contraception, we had done it 3 or 4 times so
Yes,
that we do
contraception is
not
so
forget this, because that is going to come. So last time also, before going to the exam, the WHO criteria, we used to,
yes,
yes,
that is
all
very
the
important.
classifications, we used to, the endometriosis, the fibroid. So in the last days
Classification.
also,
You were
we
reading.
were, yes, ma'am, we
That's
were ready.
wonderful. Now tell me, after all of this preparation, what was your feeling when you saw the paper?
Ma'am,
What was the paper like?
it was a surprise. It was a total surprise. When I started attempting the question, it was okay. So it was okay. The pattern has changed. So what we were expecting was, okay, PG exit level है, तो OBS रहेगा, gynec रहेगा, और at least 100 questions, 50-50 OBS gynec होगा, बाकी 25% तो onco होगा, 25% repro at least होगा. So we are not supposed to make them wrong, because that was my strong part, because that I had studied last year everything. I had studied Berek and Hackers, and then I had, religiously believed in you.
2020, you had prepared only oncology.
Yes, ma'am.
2022, the exam had 5 questions on oncology, but you still cleared with a wonderful rank.
So after attempting 35 questions, I was like, what is happening? I was in shock while giving the exam. And I was like, oncology questions are not coming. Infertility questions are not coming. What is this happening? So I got panic in the exam. So I started attempting from question number 158, last question.
Okay,
so I was basically,
somewhere you will find oncology.
Yeah. I was like, okay, let's do some questions which we know. So I will get thoda sa, okay, exam mein at least we know this portion. But that was a myth, because it was very hard to find oncology question, reproductive medicine question. Hardly there were any questions. And I was so disheartened during giving, the exam. I was so disheartened. And at one point of time, I was like, oh shit, I lost it again. And I was like, what I'm going to do again? So
yes, this was your feeling after the exam, which you
yes, ma'am. When
I
I was attempting the question, this was there. So
yes.
the only thing that came to, so I tried to somehow, I gathered myself, and I was like, okay, so this is the thing. We have read whatever they are asking. It is somewhere from the labor room, from the,
Yes.
ward rounds and OT. Okay, we have done residency. So let's attempt it. We cannot just leave it. It's only 2.5 hours. Then the story is over. So I somehow, yeah.
So you have to remember that you have prepared so well, and not everyone has prepared well. You're at least on an average line or above that average line. So don't panic, even if it is a difficult paper. This was the response from everyone. Everyone said that the paper was very tough. Nobody, like last year, they were okay. They were saying that, yes, ma'am, questions were kind of heard of. We knew those questions. We do stand a good chance. That was the response last year. This year, every student unanimously said that, no, ma'am, I'm not going to clear. 4 of those who messaged me that, no, ma'am, there's no chance this year, have cleared with wonderful ranks, and one of them is you.
Ma'am, I cried so much.
I understand.
So Dr. Swati and we were on call, and we discussed this twice or thrice. By the time we reached home from the exam center, and we were discussing, and I was telling her that you had a plus point because you are just a fresher, and I had disadvantage, and the paper was horrible, and I cannot expect anything. So on the day of exam,
you have done quite all right.
I was crying. I was in my room. I was so depressed, and I was like, nahi ho paega.
So this is a lesson to students that even if you think that the papers was very bad, it doesn't matter much if your preparation was very good. Your preparation should be good. You're going to stand somewhere, in the topper's line if your preparation is good. Every student is almost preparing the same things, the same kind of topics. Everyone from the last 2 papers, everyone was very sure that it is going to be a hardcore core oncology paper with basics in reproductive medicine and a few obs gynae questions. This is what the last 2 years patterns were. Yes, so it was a surprise to everyone. Yes, and then still the results are not a surprise to everyone. The results are still what it would have been if it was an onco paper, complete onco paper. So if you have read well, it really doesn't matter much.
Yes, ma'am. I was But somehow I had made that mind because, as you already know, that I had messaged you before exam, 3-4 days
Yes,
before. I was so worried. I was so tense. I was not able to
you were
sleep.
so worried.
What am I going? What I'm supposed to do now after reading so much? How can I just? I cannot just let it go after reading so much, after preparing so much. That's why I messaged
So,
you,
so the
and I was
bottom
like,
line is the conclusion is your preparation was to the point. It was top notch. So let's discuss about your preparation. It was good. You
yes,
still
ma'am.
don't believe that you prepared well and you did well. You've done obviously very well to get such a good score.
Ma'am,
So
we put in a lot of hard work,
yes,
and I had put in a lot of hard work. I used to study for at least uh, 13 to 14 hours a day,
13 to
especially
14 hours a day. That's a
I had get
very
the
high
job in the
benchmark that
end
you've set here. 13 to 14 hours a day.
because I had to do, man, I
It
had to do.
you had to
Yes,
do.
ma'am.
So it was going to pay 13 to 14 hours a day is a lot. I don't remember studying that much even during, pre-PG exams, pre-PG entrance NEET exam. Anyway, so tell me about big books. Did you read those big books? That's a important question. Berek and Hacker, Williams and Spiroff.
Yes, ma'am. American Hackers before because you had started your course in April, so I had already completed American Hackers in Feb or March. I had completed that once because I was like, I have to. I had never read big books, before this. I had never touched Williams.
This
I
was your
don't.
first book.
Yeah. So I had read American Hackers, all the important cancers, the pre-invasive chapter. The 10 to 11 chapters, the important chapters I had read.
You had read.
And I had read Kamini Rao also because before that you were not there. Yeah.
Okay.
So somehow I, managed to cover it. But once I joined your course and once I had listened to your classes and I was religiously believing in them, after that I did not touch any book. I just revised your notes because they were sufficient and you had so beautifully, covered the concepts, especially in infertility. So it is sufficient. It is more than enough, whatever you are saying. So I used to make conclusions and all after every lecture, as I have told you. कभी भी मैंने ऐसे lag नहीं रहने दिया. After every day you used to upload the video of the previous day. I used to complete it, and I used to do the MCQs also. So that's how you had also told. Uh, so what I would like to tell people because इससे पहले I was watching every topper's video, and I was trying to collect, okay, what am I missing and what I can add. So I would just like to tell them that you just have to trust someone and you have to just follow them blindly. So I have followed you blindly. Whatever you are telling me, whatever you are telling in the lecture that you have to do, you have to cover the video, you have to cover the notes, you have to cover the MCQs. That is how your one topic is completed. So I have done that. And the second thing is that the method of learning, so I am a pen paper person, but last year I was like, I just saw and people were like, the syllabus is too much, you cannot write everything in your notebook, and this is not possible because the syllabus is large. Okay, so that time I tried to study in a different manner, or laptop pe notes वगैरह बना के. But when I was giving the exam, so I had this feeling. So this mistake which I did, so I will, I just want to tell all the juniors who are preparing. So till now, you all have given so many exams. So all of you know what is your method, with which you are comfortable. So this time I had made your notes, your the OBS, especially hypertension, heart disease. So that they are very huge slides and all. But once you just write it down, so it becomes so easy.
Yes, writing
So
is like two revisions.
yeah,
It's like two reading.
yeah. So
Doing two readings is equal to
I
one
just want to
writing.
tell them that whatever your method of choice is, you are supposed to follow that. It
Yes,
doesn't matter which exam you are giving. You by this time you know by which method you are comfortable.
yes,
Some
very
people
well.
are comfortable reading online on their tabs. They are okay with it. But some people, they are pen and paper people like me. So
Most people are pen and paper people. What happens is in the exam, you remember on this page on the left hand side, I had written this.
yes, ma'am,
And on this
definitely.
page on the right corner bottom, I had written this.
Yes,
That
ma'am.
effect is gone on the laptop because every page looks similar.
Yes,
And
ma'am.
that effect I remember from my MBBS times, we would remember the highlighted point. This was highlighted
That's
in
what.
green.
That's
That
what.
is not
Because
there in the
even
laptop.
if you're, just going through it, so brushing is, so, when this is going to help you, when you are, just 3 or 4 weeks are left and you just need to revise. Okay. At
Yes.
that time, it will
That
pay
time
all your hard work of,
your handwritten
writing.
notes are going to help.
Yes, ma'am, because
And
you can just brush
not
up. Okay, यहाँ ये लिखा
cannot
है,
be
यहाँ ये लिखा है.
anyone else's notes.
Ma'am, it's actually, the thing is that when
Like,
you are making your own notes, you put in some time. So your
yes,
brain is actively focused when
yes,
you are preparing
exactly.
your own notes. And you know, okay, where something is. So you are putting in hard work. So your mind is active.
Yes.
So you know what are you writing. When you are taking someone else's note, so it will give you a false satisfaction. Okay, you have read, but you will forget. So if
Right.
you are good at it, then it's fine. But I would definitely prefer if you can make your own
Make
notes.
your own. Wonderful.
Yes, ma'am. Because
So
if it
this,
is yours video is 1 hour or something, like they are never ऐसा कोई छोटा मोटा video नहीं रहता है. But if I sit down, so I can complete that in 2 hours. थोड़ा सा speed में, or it can be done. So I had covered all your videos, all your notes. I had covered. So I was having thoda sa, less confidence in OBS. So this time, when I was preparing for this exam, I had written down everything. And as last time you had told us that you are supposed to read RCOG guideline also, ACOG guideline also. So previously what I did, last time I read all those things. But 1 day before exam, 2 days before exam, it is very difficult. You cannot open that thing and you cannot,
those guidelines. Right.
Yes, that is the problem. So when you read for the first or second time, you have this satisfaction. Okay, you have done. But the problem comes when you have to revise. And this happened with me also. I was also not able to revise, but I followed your advice. So what I did, if you have taught me hypertension, so I had made hypertension notes, but you had also taught that you have to do it from RCOG also and ACOG also.
Right.
So I had, also made those notes also.
See,
Similarly for liver
it
diseases, heart
gets
diseases.
difficult to teach from everywhere. That's
Yes,
why I
ma'am.
keep telling you all that read those two. Those guidelines
Yes,
are
ma'am.
easy to read. It's easier than the textbooks, and you
Yes,
get a lot
ma'am.
of questions from guidelines.
So the infections part also, it is tricky, but once you make your own summary, then
Yes.
it becomes easy. And then you can, just revise in your mind. So it is very important. So last year I had prepared. So I had already made those notebooks. I had, whenever you are doing MCQs, whatever MCQs you are making wrong, it's better you should write down, because it will help you a lot when you do not have time. You can just go through, okay, what was our mistake and what is this. So I had 5 or 6 notebooks of mine which I was trying to revise, although I was not able to do everything, but I made sure that I do of those subjects, of those topics which I feel is I forget or it is difficult. Similarly for VTE, venous thromboembolism, it is a humongous chapter, but
And very important.
once I made those notes, I was so thankful to myself during when we were revising, because it was so easy. You forget when you read from the slides again and again. That memory is, it doesn't stick, because I had done that. Last year
Because
I had
every
done
slide
that.
looks the same.
Yes, ma'am.
And it's not your hard work. I remember because I have written them. I have typed them personally.
So last year, what I had done in my laptop, I tried to write everything and all. But the thing is that because it is not in one page, so
yes.
yeah, so that's what you have to do. Whenever you have done, you just make a summary on that page. It is going to help a lot when you do not have time.
So this very important tip that you have given is make your own notes. For those appearing, for the next NEET SS exam, start making your notes right away. And then stick to a schedule that you have made. Yes, finish the topic in whatever time you have decided for it. Now tell me about your last month's preparation. What all to do in the last 1 month?
Ma'am, last month, as I told you that we were studying together. So we used to have one hour session in the morning and the evening. And then we had this,
so what were
important topics.
These sessions on? These sessions were on video calls or messaging?
A WhatsApp call we used to do. So a normal WhatsApp call. So it was a voice call only. So it is not necessary. Yeah. So voice call, one topic. For example, if we are doing OBS, then we will finish venous thromboembolism, heart disease, hypertension, liver diseases, infections, maternal adaptations, and all. So, and Swati is like, she finishes it so fast. So we were able to cover it. So one topic, if we have decided two topics, so she will read one topic and she will revise from her notes. I will read another topic and I will, we used to do this. We used to distribute this thing.
It is
And this
so
is how.
good here.
Yes, ma'am. So I used to wake up at 5 a.m. to revise 5 or 5:30 a.m. So that was my time because so one thing is
You
also
are
there,
such a
which,
dedicated person. I have never woken up at 5 o'clock in my life, I think.
ma'am, I told you I'm a diligent person. I'm not an intelligent person because I had put in so much. So I had to, because I will not remember if I have not read it so many times.
So
But
that doesn't, you keep repeating you're not intelligent. That's not how I believe. Of course, you're super intelligent.
so I used to wake up at that time you need to choose your time. Some people are comfortable at studying night. Some people are comfortable. So I am that person, who are, motivated, and, my mind is works best at that time. And I feel so good because I am starting my day early. So I can take 1 hour ka break in the afternoon when I'm tired or something or like that, because I have this, you get that momentum when you start early. So when I was starting at 5:30 or something, so I was like, okay, I have started and now I'm happy. So like this.
So
So
you were working somewhere or you had given time to NEET SS?
I was working, but during the last 1 month,
Last
because
one.
the post was of 6 months again. So I had not joined anything because we had to,
So
accelerate our.
where were you working?
I
How,
was working in ESIS,
okay, so how
Mahatma
was the working?
Gandhi.
What were the working hours?
It was till 4. Actually, they had this labor room under construction, so that worked in my favor. So if
Well,
labor room is not there, then
not there. Then what?
80% of the headache is gone. You can manage OPD, you can manage OT, you can manage everything.
But labor.
Whereas, yeah, so I was lucky that their labor room was under construction, so I
So
got time to
till
study.
1 month before the exam, you did not study 13 hours a day. It was only in the last 1 month.
I was trying, I had my phone in which I had made
Okay.
groups. So I had added my husband in that, and I had made, okay, these are the ops table, these tables are important things. So I used to keep on revising that, because so whenever I used to study something, whenever I'm doing one topic, so I used to click those pictures. For example, that Escherichia classification had come, enzyme classification had come, endometriosis classification was there, fibroid classification was there, or fistula classification is there, or some important concept is there in infertility or in oncology or something that you have added. So I used to click a picture, and then I used to, whenever I used to get time, I used to just scroll and see.
So you were eating and breathing notes in the for preparation. You were, that is a lot of diligence there you have got. So all the time you were constantly in touch with studying, whether you were working or not working.
Yes, ma'am. Because when I used to wake up, I used to start at 5 or 5:30. So I used to get, those 2-3 hours. So those 2-3 hours used to give me the momentum, and the rest of the day whenever I used to get the time in the lunch hour after the OPD, or whenever I'm not on call, so I used to utilize that. So in that time also, 8 hours फिर भी कैसे तो हो जाता था. So that was it.
So you know what, Dr. Asha, you are the most hardworking student that I've come across. Last year, I took an interview of a lot of toppers, but none of them, I think, had put in so much hard work. So this kind of interview also scares the coming batch, that you have to study 8 hours daily for a year and then 13 hours daily for the last 1 month. So of course, such kind of studying will definitely get you a rank in first 10, but otherwise also a little lax will, if you are doing it properly.
Ma'am, the thing is that, the problem is that you have very less seats.
Yes.
Last year, I
And
remember
everybody's
the
preparing.
MCQs which I had, I was nervous, or it was an exam pressure. I don't know. The exam was good, but still I'd made some mistake and I landed nowhere. I had nothing. So it was equal to, doing nothing, preparing nothing. So that I was not happy with. So that is why I was like, I do not want to land
Everything.
up there again in that borderline area where you are, everywhere. Because I was very hopeful that I will get somewhere. I will get one seat. So till the
You could
second.
have done it last year also
Yes,
if you were
ma'am.
a little more careful for the NEET
Yes,
SS.
ma'am. Yes, ma'am. Actually, that's why I told you, because my mistake was my mindset was not good for the exam. That's what I told you. You have to think positive. You have to, back yourself, and you have to motivate yourself, and you have to again tell it, because that's what I used to tell myself in this preparation. Okay, I haven't come this far just to come this far. So, I have to reach there. Yes, ma'am. So that was the thing. And it's like I today I really want to say this, and I mean every word of it. If I can do it, then anyone can do it. You just need persistence. There are some difficult choices you have to make, some difficult decisions you have to make, which are not very easy in practical lives. Okay, so but if you are dedicated to it, and if you really want it, because I had given my everything to this exam. And if you are
There was a
persistent.
movie, Shreyas Talpade's movie Iqbal, where they had said that if you want something, with so much heart, if you want it with the kind of desire that you have, the whole universe,
Yes,
tries
ma'am.
to make that possible for you. So that
Ma'am,
is what
that's
I remember, with so much earnest effort, so much efforts from your side, the universe had to answer to this. So I believe that Dr. Asha had done a lot of practice for this exam, but I am sure the other students' interviews will be a little relief to the next year's batch. This interview
it is not something which people should be scared of. It is just a
it is
subjective
scaring
thing.
me. It
It
is
is,
scaring
ma'am,
me.
it is
The
just
kind of studying that you have done, Dr. Asha, it is rare. So,
ma'am, it is a subjective thing. If you have given me some topic, someone will be able to cover it in a less time. I will take more time, but I
that
will,
happens.
I will give you a good result.
You will do
It's
it
like,
eventually.
yes,
That
ma'am.
happens with me also. If I read a chapter
No,
once,
ma'am.
I'll not be able
No,
to
ma'am,
answer anything.
you
No,
are
no, no.
very
I am a very,
intelligent.
very slow
You are
learner.
very intelligent, ma'am.
I
No,
am a very
not at
slow
all.
learner. I have to read a chapter double number of times compared to an average student to be able to answer. But once
Then,
I've done it, I'll be able
yes,
to
ma'am.
answer it.
Yes,
So
ma'am.
that is what you're also saying, that I'll not be able to do it in one revision, but
Ma'am, I'm a conceptual person. Once I, get some concept in a
then
topic,
you will,
then I love that topic. And then
yes,
I'm like,
that's right.
okay, this is good.
That's
And
intelligence.
if there is cramming, then it is difficult for me. It is very
So this
difficult.
is what, if somebody is able to memorize everything, they will do it in one revision. And if somebody has to understand the concepts like you and me, they will need 5 revisions of the same topic.
Definitely, ma'am.
This is what
Definitely, ma'am.
happens. I cannot memorize anything unless I am thorough with that, unless I understand the slightest detail of that chapter.
Yes, ma'am.
That why
Yes,
is
ma'am.
this so? Why is it not that way? So that takes time. That is why you had to put in so much. And
Yes,
there are
ma'am.
people I have interviewed who don't care much about the concepts, who just ask me, what are the facts? Is it
Yes,
this?
ma'am.
The answer, some people will clearly ask me, what is the answer to this MCQ? And they'll do good. They don't know why the answer is this. They just know that this is the answer and they'll do good. They'll memorize, mug everything.
Yes, ma'am. Yes,
My
ma'am. I'm
husband,
not in that category.
to give you an
Ma'am.
example, my husband has done UG from KEM, he's done
Okay,
PG from PGI, and he's done his MCH from AIMS. And
okay,
he is one that he was rank 1 in the MCH exam, and he's one that kind of student. He doesn't care about the concepts. He's a very good clinician, of course. He doesn't care about. I asked him, how did you do statistics in the AIMS exam? He said, I mugged all those questions.
That I cannot do. I cannot do, ma'am.
Yes, I cannot do that. AIMS exam, every year they'll ask you statistics questions.
Ma'am, yeah, one more thing. So I have given AIMS exam 3 times. Every time I was selected, but I was not, getting through the interviews. So,
right. AIMS exams are only for revision,
yes,
for OBGY people.
So some people do not give it, but I would suggest that, the exam is very unpredictable, as it was this time. So
yes.
I don't know what helped me, but somewhere in my subconscious mind, things were there.
Messaging all the students that you have to take the INISSET.
Definitely, because it is you are in that environment. It is your actual
That's
test.
the best mock test that you can get.
Definitely, ma'am. Definitely. You are supposed to give, because you will, come to know about the questions, and somehow you will be propelled from inside. Are yaar, tumko ye question nahi aata tha, come on. Now you go and revise. Okay, what is the answer to this question? When you, look for
every post PG exam, I think every student should attempt.
Definitely, ma'am. Definitely. So it, cost at 4,000 or 5,000, but it's worth it, because you get get to know the MCQs. You are sitting in that exam hall. You get that feeling also.
Are quite standard papers.
Yes, ma'am.
They give you questions.
Yeah, definitely. So they have repeats also, and they have their new questions also.
This year, surprisingly, many repeats were not there. In fact, I couldn't point out any repeats that were there.
But I really liked AIMS exam, because it was like, onco head, you have to study oncology. There is no confusion.
No controversies.
Yeah, there is no confusion, and you just go for it. So you get, a good number of questions with you, and you get that feeling of sitting in exam, and where you are. Okay, be it in that particular subject.
Exam, which is going to be probably held in November, is for all of you all who are preparing for NEET SS or FET or any exam post PG. Do take every exam that comes across.
Yes, definitely. Because when this NEET SS exam had only hardly any oncology questions, and those questions that were there, they were not straightforward, or they were not basics.
They were very
also clinical. They were also थोड़ा ऐसे कि OCPs किसके साथ ये है associated है या ये वो. So I was able to attempt those oncology questions, 4 or 5. So those were, correct.
The oncology questions, one was very easy. The others were very difficult. Whatever questions were there, they were difficult.
So, ma'am, I was able to, I have not seen the recalls, but I'm sure that my oncology questions are correct.
There was one on adenoma malignum, which is not an adenosquamous cancer. So out of all the important points in cervical cancers, you asked this. That was surprising.
Yeah, that's what. So these questions of mine were correct, because I had studied. And when you give AIMS exam, other histologies is a very, favorite topic of theirs.
Yes,
they will definitely ask you.
One chapter, pathology chapter, American Hacker.
Yeah, they will definitely ask you. Hornin's criteria. And the pre-invasive chapter, so they love. So this Hornin's criteria, melanoma, and the other histologies, the conventional we do, but other histologies, AIMS people, they love. So once you give that exam, so you have that hunger. Okay, exam mein pucha hai, so we should know. Yeah. So whenever you are reading the topic, you will not leave it. Okay, ye to aise hi hai. You will remember. Okay, AIMS mein pucha tha, so we should know this. So that's how I and Swati were doing. So I had, I had some, because I had given this 3 times. So that's what I was telling her when we were preparing. So she was like, this will not be asked in the exam. So I was like, no, this was asked in AIMS exam. They can ask, they can ask anything. So they can ask, if they can ask Zahara criteria,
that was
then they can ask anything.
Every year they have such surprise questions, but this paper was full of surprises.
Yeah. So MCQ practice is very important from wherever you are getting it. Do give AIMS exam if you are seriously about this exam.
See, wherever you're getting it means they'll practice from anywhere. The students will practice from anywhere, and there are some very, substandard sources, and they'll ask me a lot of questions. Why is the answer this? I have a lot of complaints with those sources. They just give you random questions and random answers. They don't give you references. And
I trust you on that. Once you say that, do not follow this source, I'm like, okay. I will never see any question
some
from
questions,
this
are irrelevant kind of questions. They don't give you a reference. And then that's a lot of hard work for me. I have to, read that chapter line by line to pinpoint where that question is from. And then I come to know that this question is bakwas. It's all wrong. They have themselves not read this and they've asked this stupid question. So that ways you have to know which source to read and which source not to read from. MRCOG recalls, I would say, is a good source, but this year there was no exam.
I had not done.
You've not done any recalls.
There were few things which I had done last year. I did not do this year. Okay. I had not done Rashmi Vora. Last year I had, diligently and religiously. Last year I had done it.
It's a small book.
Last year I had done it. So this year I was not into it. This year my focus was, because this was a PG exit exam. So my focus was, and that's what I told Dr. Swati also, that because this is going to be a PG exit exam, so we should focus on obs and gynae more. And we had already prepared oncology and infertility, because you had already covered it so nicely. So, our focus was that. So that's why I try to, yeah, I have also done very big mistake. I have wasted 2 or 3 weeks of mine. It was a very important time before 2 months exam. I tried to study Spiroff. So
and that's a big
it
mistake.
took me a lot of
All
time.
those preparing for
It took me
2020
a lot of time. Yes, ma'am.
not open Spiroff now. Even
I wanted to cover some topics. For example, disorders of sexual development and all those things.
I have
So,
covered that nicely.
yes, ma'am. So it was taking a lot of time. So I had messaged you. So
Yes.
you had asked me if you had not read it previously, then do not study it again. So after that, I closed Spiroff.
Yes, Spiroff will take a year to finish few chapters.
Yeah. So, but that topic only took me. So, I wasted 2 weeks
Reading
of my, yeah. So finally I
this
closed it.
important advice for students, even if you're preparing for 2023 exam, this is not the time to open Spiroff.
Definitely.
And most of the concepts from Spiroff have been explained in the classes.
Yeah. You had beautifully covered
Spiroff is not like Williams that you have a lot of facts in Spiroff. You don't have much facts. You read 4 pages and you come to know about one fact. They explain a lot on the concept, which comes down to one-line conclusion.
Yes, ma'am. So you have already concluded it.
Classes.
So I would suggest nobody should waste time on this.
Spiroff is a wonderful book. You will get lost in it. It is a beautiful book. I have read it, I think, cover to cover 2 or 3 times. Yes, and then I have made those notes.
Yes, ma'am.
So I do believe that any question from Spiroff cannot come which I have not covered.
Yes, ma'am.
That's not an overstatement to make.
Last year, ma'am, I had also, read Sakshi Arora. So last year I had read Sakshi Arora.
Sakshi Arora should not take more than 5 days.
Yeah. So last year I had read, but I got thoda confused. So what we decided, we will not do that book, and we will, because it creates confusion when, period of gestation or some.
Yes, some mistakes are there. Mistakes are
so we were like, we do not want to confuse ourselves, and we did not touch that book. But while giving the exam, this surprise was there. So I was like, at least the OBS part should be done, because it covers.
I have been advising people that Sakshi Arora is a small book, Rashmi Varoda is a small book. Cover them in 4 or 5 days.
Yeah. So just go through at least the OBS wala part, because that pre-PG level
are there, I am very well versed with those mistakes. The same questions will be coming. So I'm not scared if people ask me questions from Sakshi Arora. There are mistakes which we can discuss, which all I can pinpoint that these are mistakes. Don't follow.
Definitely.
What you should follow.
Definitely.
So I would recommend that you have to go through all the questions of Sakshi Arora.
Because they are asking, pure so your pre-PG level is covered. That book will cover that basic level.
Yes. So that is one of the first things that I advise. Finish Sakshi Arora first.
Yes.
You have to, at least that much. It doesn't take much time. If you are confused, if there is a doubt, I am always there to clarify.
So MCQs they have doubts, so that can be that will be clarified.
That can be clarified. I'll go through the book.
I had also made one different folder, in my mobile. So I had this another group in which I had kept those questions which you had corrected and which were given wrong in places.
Yes, there are many such questions.
Yeah, some concepts also, and some
those
MCQs
corrections
also.
Which I make are not from my belief, are not the things that I believe, are from proper references. Because I'll always give you the reference that this proper article, this guideline is saying this, so definitely this is the answer and not what your book has given.
Yes, ma'am. So I had, made that separate folder so that again, I do not have to search. I have this in mind. Okay, so these are some questions, or group pe so much controversy is going on, but last time ma'am had cleared this. So I just have to remember.
One controversy will be discussed 5 times in the group.
Yes, ma'am. So I would also, so last year what happened was, whenever people used to discuss in the group, so I used to feel, okay, they have read so much. And they have read RCOG guidelines also. They have done this also, that also. So I would just like to say that you just, focus on your preparation, to believe on your preparation. It is not important to, controversies ko ghasitna is not important. You save your time.
Very good advice.
Yes, you save your time. You just post it in the group. Whenever ma'am clarifies something, you just go with it. And you just don't waste your time on it.
The point is, I have been through those controversies over and over in the past 3-4 years. And I know that this is wrong and that is right.
So sometimes, when I used to study
they keep nagging with it. Why is this not the answer? Why is that the answer? So you have to believe me on those controversies.
Yes, that's what I'm saying. So there was one question which I had also posted 3 or 4 days before exam, that neural tube defect question. So I remembered that last year somebody had put it in our group. So I
was
searched
very
for it.
disheartened at that question of yours. A lot of students, so it was a surprise to me that how can students not remember this simple concept?
So so what I'm saying, in group, these questions are there. So I remembered, okay, last time somebody had put this question and you had clarified it. So I will, go in the search option and I will try to find
that. Is what I do.
See.
And that is what
Yes,
I do. I go to the search option, I copy that answer,
yes,
and I put it again.
Yes, ma'am. So that's what I also do. I am not very confident in posting things in group. I'm like, I'm not confident.
Swati would clarify 70% of the doubts which students would post. So whenever anybody personally asked me a question, I would say, please post it in the group. Yes. Because I knew somebody will answer and that answer will be very correct.
Yes, ma'am. So it is your wish if you want to be active in that group. So you utilize it maximum, but never, get disheartened or never compare yourself. Yes, ma'am. So, you just follow what ma'am is saying, and you should benefit from that group. Whenever you have some genuine doubt, you just post it, you will get the result, and stop it there. Just don't look for anything. So I have saved a lot of time. I have religiously trusted you. Whatever you have said, I have just, okay, इतना ये है, अभी इसमें और time नहीं waste करना है, just move on.
Every doubt that the students post, it takes me 1 or 2 hours or even more to find the correct answer and to post it properly. So all those answers that I put, I have put in a lot of hard work to find those answers, because these are doubts posted by people who have done PG. So I take them seriously and I answer them, diligently the way you prepare. So I also put in efforts.
Yes, ma'am. So that is why I trust you, because yours are very standard. Your way of, all the lectures, the way you make us prepare is very good. I just loved it. It's not कि ऐसे हवा में है. It is everywhere. Some, good standard things are there, which you just tell us that we have to, and then we are also, okay, these are the standard guidelines. And then we also, love learning it. I just loved learning.
I make it a point that I don't blabber out my thoughts. Whatever I say is backed by some reference.
That's what, ma'am.
So you can trust whatever I'm saying. Every word that I say in the class or write in my notes have been taken from some standard book or some standard article.
So whatever you say, I will pause my video. I will go back once or twice. I will write it down. Especially in infertility, I have done this so religiously. Every word of yours. That is how I was able to understand it. Otherwise, there was no way. I was so scared of it. And so whatever you used to say, while explaining the concept, I used to write down everything. And that is what Dr. Swati also used to do, because when we were studying together, so I also used to say those things which you had, not written in your slides, but which we used to say. Yeah. So my mind was like, okay, whatever ma'am is blabbering is very, very important and you should write it down.
So all of that blabbering, comes from somewhere. It is not my personal
thought. It was important. I had given so much, importance to that, and I have taken it so much seriously.
That's so nice of you. It is so wonderful talking with you, Dr. Asha. You've given a lot of tips to the next batch students. You are going to be opting for gynecologic oncology, right?
Yes, ma'am. Yes, ma'am.
So you wanted oncology all through.
Yes, ma'am.
All the best for the counseling. You have any idea when the counseling dates are?
In 1 week, we may get an idea when it will start.
So there's no official notice on the dates?
No, not yet.
All right. So all the best for the counseling. We'll stay in touch after your counseling and even after that. And
yes,
in the group, stay in the group. Stay,
I will be, ma'am. I was thinking of I was thinking of asking you for lifetime subscription. I want to be in touch with you.
I have given unofficial lifetime subscription to one student. I will start giving it to the toppers of all batches. So, all right, you get a lifetime subscription.
Definitely. I was definitely asking for this because I want to be in touch with you, throughout. I want to be, I love
what I need from y'all is the doubts that students post. You have to clarify if you have got time.
Yes, ma'am,
now that
definitely,
you will
ma'am.
be doing oncology?
Yes, ma'am, definitely, ma'am.
Right, that helps because a lot of students, same doubts will be asked every
Yes,
batch.
ma'am.
They have got the same doubts.
Yes, ma'am.
So
Yes,
keep
ma'am.
answering those doubts, stay in touch.
Sure, ma'am. Sure, ma'am.
Uh,
Thank you so much, ma'am. As I have told you, you're a wonder woman for me.
so nice.
And it was very difficult. I the journey started, and yeah, one more thing that I would like to thank my friends, because of, they had seen something in me, and they believed in me, and they told me that you should go for it, you should prepare for it. I had no clue. There was no material available. There was nothing. I had to start from zero, but they trusted. And when I got a rank of 500 and something, then they were there to motivate me. Okay, so these things take time. You have to cover the content. The seats are less, so it takes time. So you should not be disheartened by this. So I prepared again. After you had come into picture, I was very confident. So that preparation also, the exam, I got somehow nervous. I made some mistake. So I was somewhere borderline. So at the moments when I had thought of, giving up, so they were there always to support me and to remind me. They are the ones who had believed in me. They were busy in proving that you can get a rank.
So
I
this
was
is
busy in
your
proving
family
them
or
that
friends?
I cannot.
You're talking about your friends or your family?
Then my friends.
It
So
is so lucky to have friends who are not competitive. On the other hand, who are supporting and
we had done so yeah, so my
encouraging you.
friend, yeah, so she had done her DMRD from Naya Hospital when I was doing my MS from
All
there.
right, all
Yes,
right,
ma'am. And now she's doing radio diagnosis, radio oncology in Tata Memorial, Mumbai.
all right. So both of you
Yes, ma'am.
kept
Yes, ma'am.
encouraging each other.
So after my last attempt, my husband was also like, he realized, okay, I'm not, I'm serious about this.
You're not going to give it up so
Yes, ma'am.
easily.
So this time he was also supportive for this attempt.
Wonderful.
Yeah. But I would like to say that if you, that again, persistence, hard work, if you want, I was also on the other side 2 or 3 months back. I would again say I had started from zero. I had never read any standard book. I just followed ma'am's notes blindly, and the plan which ma'am is now having for this batch, okay, is commendable, which I had already discussed, because I told ma'am that I will not give up. I will again join. I will again prepare if I do not get a seat. So ma'am was like, you wait for the results, you will definitely get it.
Yes,
So
many
you should
students
have
have
this.
message that please wait for the
Yeah.
result.
So you should have this thing, this kind of attitude that you will get it. Then definitely you will get it. And then definitely you will be sitting on the other side.
Wonderful. Wonderful, Dr. Asha. Tell me the result. Who told you the result? Was it me or it was someone else who had told you earlier?
So I was so nervous, and right now I'm at my home place, Kurukshetra, with my family. So my family was already, I had told everyone. So you are not supposed to call me after 3 p.m. Just leave me in my room alone. So all were prepared. Okay, she's going to cry. She's going to lock herself up. We don't know what the result is going to be. So I was, scrolling, and I was saying again and again. And all of a sudden, all the PDFs had come. So I logged in, and then I saw the PDF, and then I had tachycardia, palpitations, everything, and I was I was just taking God's name, and I was like, Ganpati Baba, please, please. I was